Right, back live with you here on In Focus. Health Minister Dr. Aaron Motsoaledi is proposing that a team of experts and retired judges be set up to adjudicate the medical legal claims in the country. He told a joint meeting of various parliamentary bodies today that he believes this will ensure the cases do not drag out in court for years. Motsoaledi again painted a picture of how lawyers are using government as a cash cow to make fraudulent medical claims while exploiting the poor. Chairperson of the Appropriations Committee, Mmusi Maimane, joins us now. Mr. Maimane, good to have you and thank you very much for your time. Let me just deviate a bit. We'll come back to this because it's not related, but it's a matter of interest to you, I know for certain. Is the stability of the GNU under threat over the Bella Bill?
Good evening and good evening to fellow South Africans. I think what's most important is that what I felt was always going to be the clash points were on issues of policy. To form a government is the first and easy part. Like I called earlier on, that there needed to be a dialogue that sets out the framework as to what is to be achieved. And so the Bella Bill is but one example. I can assure you as night follows day, next will be the National Health Insurance. And then all the things that have been hypocritical, that parties have been hypocritical on, such as whether there's enough security and resourcing us. Our public sector wage bill is already too high. And so parties that were always critical of that, particularly the DAF now, in the interest of patronage, have come in on board. And so what I think is going to be important now that we have to focus on is to achieve that plan, to ensure that now we have a vision going forward. And I really believe that the person of President Ramaphosa will be able to negotiate through this moment.
So you met today, joint partners with SCOPA and Department of Health to look at this question of medical legal claims. And I suppose, as you put it, key to what you were trying to do is scrutinize the implications of this in service delivery, whether people were in any way compromised by this in getting good health in the public service, but also you seek to find those who are doing wrong, hold those who are doing wrong accountable. Talk to us about the report that you've got on hand. What does it say about systemic problems at the health department, at the state attorney, maybe even at the level of legal professionals?
Yeah, I think the alarm bell that was rung today is that South Africa has entered into a phase where whilst its health framework is based in an, if you like, a British model, it has followed the American style of litigation and lawsuits over issues that take place. The second is, obviously, when you look at two sides of one coin, on the first side is all of these legal practitioners, health practitioners who sell medical records, ultimately a capture of some forms of the judicial system. I'd also read through the SIU report about what exactly is going on in the Eastern Cape. And furthermore, that in fact, it looks like the syndicate moved from the road accident fund into the healthcare, particularly at key areas of medical intervention, most notably obstetricians and gynecologists at the birth of a child, because the diminishing levels of oxygen given to that child at birth often can result in cerebral palsy, which then adds to the medical legal claims issue. So that's on one level. At another level, we have to really look at systemically, what are we doing to our doctors and making sure that they're not working long hours? How do we ensure that we reduce the incidence of mother-child mortality rates so that South Africa doesn't become an outlier even higher than some African states? How do we ensure that we digitize record keeping so that there isn't this practice of selling medical records? And also, how do we ensure that from an infrastructure and a legal point of view, we don't end up with what is appropriated from the fiscus, ending up in matters of administration and at the end, medical legal claims, instead of, in fact, to the beneficiary of South Africans. So this is a moment that we've got to say, as we fought state capture, we must fight this syndicate, fight extortion, but ultimately ensure that all rands and cents, which is my priority, is to make sure all money is spent on citizens directly.
Yeah. So, I mean, what then Parliament needs to look at there is whether the implementation of laws is in line with the laws of Parliament, the laws of the country, the constitution that is, but also those who've been tasked with that responsibility are doing what they need to be doing. Now, the minister painting a picture that this boom would have started in 2015 following some tightening that is happening at RAF. Now, there have been various ministers who's been in place. So the question is really, when I say minister playing a role, I'm saying any minister in that department that would have sat there, did they play their part as far as their responsibility is concerned in ensuring that this does not happen?
Well, I think the first most positive step is the invitation to the special investigating unit, and that proclamation being issued. I think that's important. But I do think a lot more could have been done. I mean, I think that we sit here today in our democracy without digital records to healthcare, both in at first level in the public service, and at a second level creating a system that allows both public and private to be able to speak to each other. I think, to me, speaks of a negligence by the part of the executive over the periods of time that we're discussing. And so Minister Motsoaledi is doing the absolute right thing by insisting that that project must be completed. And then the other issue is the fact that if you and I get into a case of any form of legal claim, that we end up in court as the first place means that if you are in Gauteng, the first time you'll be able to appear before a judge is in 2029. And I think that speaks to the fact that in that period of time, if you have a legitimate case, which I think is the case in certain instances, you could end up really with your quality of life being severely impacted. So we've got to come back to say, how do we resolve disputes quickly and effectively? No one can deny the debate about doctor-patient ratios and what those look like. And that, in fact, when we're living in South Africa, we've got overly worked doctors. We've got public healthcare facilities that are not always in the best conditions. And we end up with ministers who simply can say, well, let's deal with acts of criminality and ignore the broader quality question about what does it mean to provide excellent healthcare. And so I want to be able to work with Minister Motsoaledi to say, when we do appropriations coming in this next budget cycle, that let's ensure that at the end of the day, all money is spent on the patient, and that where there's wrongdoing, accountability is felt. Because, as you say, this matter started in 2015, yet there are health practitioners who still remain within the system, who are still who have not been charged, or ultimately, as incidents continue, there's no consequences internally in certain instances.
So on this question of synchronization and digitization, was that budgeted for?
Well, it certainly was commissioned, and so we'll be able to interrogate further in the health department as to where this matter goes. And I know, because health is one of those issues that deal with all three spheres of government, in that the National Health Department has its own mandate, and then the provinces, in fact, run many of the hospitals. And then in some municipalities, you know for a fact that the metro runs clinics, etc. Health is one of those services that run across all three, so it makes it fairly complicated to manage. What we must do is to say and commend, in certain metros, you'll find that there's biometric systems that allow for patient records to be accessed digitally. But in other places, there's not. And so when you look at it across various provinces, which is the point I'm trying to make, is that certain provinces budget for the system, implement it and use it. Other provinces are still lagging behind. So we need to think hard about how do we ensure that there's standardization across the country? How do we ensure that records are digitized and cannot be accessed by any person? Because part of what increases the levels of medical legal cases is when a health practitioner is able to literally take a file, issue it to scrupulous lawyers, and then in a sort of way, in a carnivorous or in a way that these groups act in collectively, begin to chow off what is going on in the health budget in total. So we've got to ensure that this project succeeds if we're going to safeguard the future of healthcare. No, it isn't only just a matter of ensuring that we deal with medical legal claims. It's also about ensuring that as we provide care, that a patient who says they are going to travel to multiple provinces, that those records are available. But if they access private or public healthcare, that we've also got access to those records, because then you end up with a citizen who's able to pay, and a citizen who can't pay being able to access support from the state.
There's this debate that then went on around the capabilities of the state having its internal forensic investigative expertise in the department itself to be able to assist health facilities and so on and so forth. Where do you sit on that debate?
Yeah, I think it was in some ways a misplaced debate. No institution is able to harness all expertise in-house. You would never find that in a private institution. You would never find that equally so in a public institution. What happens, and actually I welcome that there can be an external institution that is able to say, let us give fair hearing and forensic evidence so that the health department isn't focused on being, if you like, a unit that is also policing people, that it focuses on delivery of quality healthcare. But then you allow external institutions that run forensics, updating their system, knowing how well to look out for evidence, tracing of money, so that they can specialize at that. And I think that you can be able to outsource it. You don't have to burden the citizen with the in-housing cost of all those experts sitting inside. And so I think ultimately, as a partnership between that and external suppliers, we could really fight the issue. Lastly, I think it's also important that when you locate these forensic services, because that is effectively what we are discussing, is that actually they must deal with both public and private. Because medical legal claims don't just occur in the public sector, they occur equally so in the private sector. That's why a gynecologist or an obstetrician, if I'm not mistaken, has to take out insurance to the value of 1.3 million rand a year, which gets passed on to the consumer. So when you look at it from the broader South African public, where the person is on GEMS or any other medical aid for that matter, you must be clear at the fact that once they want to use, particularly women in this country, because many of these issues are actually in the areas that affect women, that they have to carry the cost for being able to cover that insurance in the private sector and ultimately face the risk when gynecological services are becoming less available in the public service. So I think it's important that we focus the healthcare budget on what it's designed to do and try and eliminate and do more prevention so that we don't have an escalating issue on medical legal bills. I think ultimately the last point I want to make is that actually departments need to think hard about budgeting for medical legal claims.
I wanted to come to that. What does that mean? Because at your level of appropriations, you need to have an interface that is forward-looking, yet being able to also assess the legacy issues that you would have been looking at now, particularly with this particular presentation. So what does that mean in terms of the applications of budgets going forward?
Yeah, I mean, the National Development Plan sets particular targets as to where the levels ought to be by now, and I think they're less than 10 billion rand annually. Your biggest dilemma is the fact that the Department of Health, or particularly provincial healthcare departments, have an accrual system. So you find that, which was the point raised by the Auditor General today, is the fact that claims that come back from last year come into this year's budget, and then before, what the AG does is that it insists that before you can continue with this year's health budget, you need to settle previous year's claims. And so what effectively happens is that cumulatively, as this figure grows as a start, and secondly, if you have on one year a very disastrous year, you could end up with having to pay back much of your budget into medical legal claims or the claims put forward, rather than in fact providing healthcare. So there must be a space upon which we eliminate scrupulous behavior. We make sure that claims are consistent and that we budget accurately so that the figure doesn't exceed what the National Development Plan has put on the table, and that departments aren't being hampered so that they're spending their budget settling these rather than in what is now typically an unfunded mandate effectively, but rather focus on the quality of healthcare. For me, the fundamental question in appropriations is this, is that for every rand that we get in this country, does the money end up in its majority in providing quality healthcare for the citizen? That's the only question. And the moment it gets cut off by matters like medical legal claims, administrative costs, pure leakages, then I think we are missing our constitutional mandate and shortchanging citizens.
Musi Maimane, appreciate your time. Thanks for coming on this evening. Chairperson of the Appropriations Committee there, Musi Maimane.